الرحمن الرحيم، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا محمد عليه أفضل الصلاة والتسليم. معاكم لجين السناني من كلية الأمير سلطان العسكرية للعلوم الصحية بالظهران، مستوى خامس في قسم الرعاية التنفسية. استكمال لفقرتنا اللي هي Pediatric Diseases، اليوم بإذن الله راح نتكلم لكم عن مرض مرة مهم اللي هو الأزمة. راح نغطي مع بعض اللي هو Definition of Asthma, the causes of asthma, the clinical manifestations, how to prevent and treat asthma. We will take also اللي هو ABG and the Xray of asthmatic patients. The first thing is, what is asthma? Asthma is a chronic obstructive lung disease characterized by the increase in airway responsiveness due to various stimuli. It could be dust, it could be allergic, it could be other factors, okay? And the main character in asthma that you will see it when the patient have asthma attack are, first, اللي هو airway inflammation and the mucus boiled up and reversible bronchial smooth muscle constriction. What are the causes of asthma? Why the patient have asthma? Until now, the pathogenesis of asthma is incompletely understood. But the experts and scientists say that we have a multiple risk factor that lead to increase the possibility of getting asthma. The first factor is a host factor. The primary host factor is the genetics, okay? And that results in the development of intrinsic asthma. The second risk factor is environmental factor that trigger the clinical manifestation of extrinsic asthma, or it could be combination of both. Okay? طيب، ايش هي triggers of asthma؟ أو ايش هي المهيجات اللي تسبب لي حدوث أزمة الربو؟ زي ما نعرف فهي تختلف من مريض إلى آخر. مو كل مريض راح يكون عنده نفس التريجرز. بس examples of triggers, the first thing is strong emotional expressions. The second thing is اللي هو viral infection and also اللي هو air pollutions, chemicals, inhalers, برضو حتى الدست والأشياء هذه، وحتى الcold weather ممكن أن يكون a trigger of asthma attack. The most common symptoms that the patient of asthmatic attack complain about are tachycardia, tachypnea, wheezing, the use of accessory muscles in severe cases, the night cough, prolonged exhalation, and chest pain. Of asthmatic attack. On inspection, you will see the patient have increase in work of breathing and he using his accessory muscle to breathe in severe cases. On palpation, you will feel decrease in the tactile focal firmness due to increase in the lung volume. On auscultation, you will hear diminished vesicular breath sound, wheezing on expiratory phase, and if it's severe, you will hear it in inspiration also. For percussion, you have a hyperresonance because of air trapping. The chest X-ray of asthmatic patient is usually appear normal, but in some severe cases, you have increase in anterior-posterior diameter or barrel chest, and also darker lung fields, and the breast are flattened of the diaphragm. Arterial blood gases will help us to determine the severity of the patient condition. So, when the patient have a respiratory alkalosis or high pH is due to hyperinflation and tachypnea. The patient is trying to take the air in and out of his lung, so he have a mild to moderate asthma attack. But when he have a respiratory acidosis or low pH due to respiratory fatigue and hypoventilation, he have a severe case of asthma attack. Generally, all of them have a hypoxia, and hypercapnia. How can I treat and prevent asthma as a healthcare practitioner? Well, actually, the asthma is an incurable disease, but it's a manageable disease, meaning we can effectively control it by intervening to suppress and reverse the bronchial inflammation, 2, by treating the bronchoconstriction and related symptoms. But put on your mind that therapy used for asthma attack is based on the severity of the situation. Here are some pharmacological agents used for asthma attack. We have a quick relief rescue therapy for acute exacerbation, mild intermittent disease. We have the short-acting beta agonist, oral steroid, anticholinergic. For the long-term controller medications, we have it for persistent asthma. We have the long-acting beta agonist and inhaled steroid. Prevention of asthma, take it as a general rule, when the patient or when the asthma is controlled, most asthmatic episodes or attacks can be prevented, and the trouble in some day and night symptoms can be avoided, and the patient will remain physically active. As a conclusion, I would like to summarize some important points that we discussed about today. The first point is asthma is a chronic reversible obstructive disease. The air is obstructed inside the lung, which lead to hyperinflated lung and ventilation perfusion mismatch. The second point is asthma risk factors could be the host or environmental factor, or it could be both. The hyperresponsiveness of airway triggers differ from one patient to another. The signs and symptoms of asthma are chest tightness, dyspnea, increase the work of breathing, wheezing, and etc. The pH is an important feature that lead us to know the severity of asthma attack. The most common asthmatic patient have a normal chest Xray. The treatment depends on the severity of asthmatic episode.